Celiac disease. Introduction. Celiac disease is a digestive disease in which eating gluten damages the small intestine. Gluten is a protein in wheat, rye, and barley. It is found mainly in foods but may also be in other products such as medicines, vitamins, lip balms, and even the glue on stamps and envelopes. Celiac disease can be very serious and cause long-lasting digestive problems. Adopting a gluten-free diet is the only treatment. This program explains celiac disease. It covers the symptoms, causes, diagnosis, and treatment of this disease. The digestive tract. The digestive tract is made up of organs through which food and liquids pass. The small intestine is part of the digestive tract. This section reviews anatomy that is important in understanding celiac disease. Swallowed food goes through the esophagus, which is the feeding tube. Next, food passes through the stomach, where it is partially digested. Digested food goes from the stomach to the small intestine. The small intestine is the longest part of your digestive system. It is where most nutrients are further digested and absorbed into the body. The small intestine has three areas: duodenum, jejunum, ileum. Fibers and digested food finally reach the colon. In the colon, the rest of the nutrients get absorbed and stools are formed. Stools are stored in the last part of the colon before being excreted. This part of the colon is made up of the sigmoid colon and rectum. Stool leaves the body through the anus. The inside wall of the small intestines is called the mucosa. The mucosa of the small intestine contains many folds that are covered with tiny, finger-like growths called villi. The villi allow the small intestine to absorb nutrients. Point to the small intestine. Choose one of the following options. Correct. Symptoms. Symptoms of celiac disease vary from person to person. Symptoms may affect the digestive system or other parts of the body. Digestive symptoms may include chronic diarrhea, constipation, pale, foul-smelling or fatty stools, stomach bloating and pain, vomiting, weight loss. These symptoms are more common in infants and young children. Irritability is another common symptom in children. Celiac disease can also prevent the body from absorbing nutrients, causing problems with growth and development, such as late puberty, short height, slow growth, weak permanent teeth. Adults with celiac disease are less likely to have digestive symptoms. Instead, adults may experience arthritis, bone loss or weak bones, bone or joint pain, depression or anxiety, extreme tiredness, seizures, sores inside the mouth, tingling numbness in the hands and feet, unexplained iron deficiency anemia. Adults with celiac disease may also develop a skin rash called dermatitis herpetiformis. This rash is extremely itchy. It causes bumps and blisters to form, usually on the elbows, knees, buttocks, back, or scalp. Women with celiac disease may also have missed menstrual periods, infertility problems, or multiple miscarriages. Some people with celiac disease may not have symptoms. However, they can still develop long-term digestive problems. Digestive symptoms are more common in adults than in children. Select true or false. Correct. Digestive symptoms are more common in infants and young children. Adults are more likely to have symptoms that affect other parts of the body. Causes. Celiac disease is an immune disease. The immune system is your body's defense system. It keeps you healthy by fighting against things that can make you sick, such as bacteria and viruses. With celiac disease, the body's immune system reacts to gluten and attacks the lining of the small intestine. The small, finger-like growths in the lining of the small intestine, or villi, become damaged. Villi help the small intestine absorb important nutrients from digested food. When the villi are damaged, the body cannot get the nutrients it needs. Celiac disease is genetic, which means it runs in families. Sometimes the disease is triggered or becomes active for the first time after childbirth, pregnancy, severe emotional stress, surgery, viral infection. Celiac disease affects people in all parts of the world. It is a common genetic disorder. It is more common among people with other genetic and immune system disorders. Which one of the following statements is true about celiac disease? Choose one of the following options. 1. Celiac disease is an immune disease. 2. Celiac disease damages the small intestine. 3. Celiac disease is genetic. 4. All of the above. Correct. Diagnosis. Diagnosing celiac disease can be hard. Some of the symptoms of celiac disease are similar to symptoms of other diseases. People with celiac disease may go undiagnosed for many years. Your healthcare provider will ask about your symptoms and medical history. He or she will also perform a physical exam. If your healthcare provider thinks you have celiac disease, you will need a blood test. You must be on your regular diet before the test. If not, the results could be wrong. If your blood test results show that you might have celiac disease, your healthcare provider will perform a biopsy. A biopsy involves taking a tiny piece of tissue from your small intestine. A thin lighted tube is used to perform the biopsy. The tube is inserted through the mouth, down through the stomach, and into the small intestine. At the end of the tube are small tools that are used to take a sample of tissue. If you have a skin rash, you may not need to have a biopsy of the small intestine. Instead, a biopsy of the skin with the blood test can be used to diagnose celiac disease. Some people with celiac disease may not have symptoms. Because celiac disease is genetic, family members of a person with the disease may wish to be tested. Talk to your healthcare provider about getting tested for celiac disease if someone in your family has it. A biopsy of the small intestine must be done to diagnose celiac disease. Select true or false. Correct. If a person has a skin rash called dermatitis herpetiformis, he or she may not need a biopsy of the small intestine. Celiac disease may be diagnosed with a skin biopsy and blood test instead. Treatment. The only treatment for celiac disease is a gluten-free diet. If you avoid gluten, your small intestine will heal. If you eat gluten or use items that contain gluten, celiac disease will continue to harm your small intestine. A gluten-free diet means not eating foods that contain wheat, rye, and barley. The foods and products made from these grains should also be avoided. In other words, a person with celiac disease should not eat most grain, pasta, cereal, and many processed foods. People with celiac disease can still eat a well-balanced diet with a variety of food. Instead of wheat flour, a person with celiac disease can use amaranth, bean flour, buckwheat, potato, quinoa, rice, soy. Gluten-free bread, pasta, and other products are also available. Meat, fish, fruits, and vegetables are also safe to eat since they do not contain gluten. Some people with celiac disease may still be able to eat oats in small amounts. Talk to your healthcare provider to find out if oats are safe for you to eat. Gluten may also be found in some vitamins and medicines. Ask your healthcare provider or pharmacist if the vitamins or medicines you take contain gluten. Gluten may also be used in other products, including lip balms and lipstick, Play-Doh, which may come into contact with a child's mouth or contaminate a surface, the glue on stamps and envelopes. Reading product labels is very important to make sure you avoid gluten. Your healthcare provider may refer you to a dietitian to help you create a well-balanced meal plan. A dietitian is a healthcare professional who specializes in food and nutrition. A dietitian can also teach you how to read food labels. Sometimes it may take a while to learn what foods you can eat and which foods you should avoid. People with celiac disease can occasionally eat a small amount of gluten without damaging their small intestine. Select true or false. Correct. All gluten should be avoided. Even a small amount of gluten on occasion can damage the small intestine. Which food contains gluten and should be avoided? Choose one of the following options. 1. Potato. 2. Rice. 3. Soy. 4. Wheat. Correct. A gluten-free diet means not eating foods that contain wheat, rye, and barley. Wheat and products that contain wheat should be avoided by people with celiac disease. Summary. Celiac disease is a digestive disease in which eating gluten damages the small intestine. Gluten is a protein in wheat, rye, and barley. It is found mainly in foods but may also be in other products. Some examples include medicines, vitamins, lip balms, and even the glue on stamps and envelopes. With celiac disease, the body's immune system reacts to gluten and attacks the lining of the small intestine. The small, finger-like growths in the lining of the small intestine, or villi, become damaged. When the villi are damaged, the body cannot get the nutrients it needs. Celiac disease is a common genetic disease. It can be very serious and cause long-lasting digestive problems. Adopting a gluten-free diet is the only treatment. Your healthcare provider or a dietitian can help you learn which foods contain gluten and should be avoided. People with celiac disease can still eat a well-balanced diet with a variety of foods.